All right, so welcome to our live stream. I'm just super excited considering this week was so big, obviously after the election, and there's gonna be so many changes that's happened in the healthcare industry and the community. So I'm just so excited to come on and talk about what it means to me as a healthcare provider, running my own private practice, and actually trying to help, you know, all our patient, all their family get healthier. And what's really cool about this whole thing is you're gonna see a lot of reform that's RFK is looking to do, especially with Trump. And most of, my friend and colleagues always asking me like, what do you think that's going to mean, especially those who are in healthcare industry and the people who are actually, injured, sick, and going through, their whole healthcare journey to begin with. And to be honest, I'm really optimistic of where we're going to head in the next 4 years, just because there's so many, things that we need to talk about when it comes to uh, us as a country, because some statistic that I have on with me on this live stream was literally just talking about how RFK is really big into attacking chronic diseases. I don't know if you guys know, but like right now, approximately 133 million American have at least one chronic condition, and 42% of that have two or more. Right, that's just according to the CDC. And the biggest shift that we're seeing is that what RFK is trying to implement, with working with President Trump, is literally just reducing disease through environmental and nutritional reform. So right, so like what does that mean is that we're probably going to go towards the model where we're using less, pesticides, herbicides, right? Because those are the things that would actually get us sick, right? So if we're spending so much money in healthcare and our lifespan is getting actually lower and lower, that doesn't mean we're trending in the right direction, right? That's actually mean that we're trending in the wrong direction. If we're spending more money, we want to see an outcome. And I tell my patient all the time, it's like if you're spending money to come work with us and you're not getting better, you're not seeing progress, that means we're not doing a good job. So that's the biggest thing when it comes to big institution like the CDC is like, how come we're not getting healthy as a nation, but we're actually a nation in decline when it comes to our future? And the biggest thing with me is the next generation, where if the next generation is not getting healthier and like child obesity is at the all-time high, that means we're not trending in the right direction. So what's cool about reducing what kind of pesticides and herbicide we're using on our food, that's probably going to make us healthy as a whole. um, what's cool is that like when I go to Europe and travel all over the world, we don't typically eat um, gluten or lactose here. But when we get over there, I can literally eat as many cheese and dairy products as much as possible, and I have literally no irritation or upset stomach at all. So to me, like, are we really, am I really intolerant to, you know, lactose or gluten, or am I just intolerant to the lactose and gluten and the quality of product that we have over here in the US? So to be able to have increased higher standard when it comes to things that they do to our food is going to be extremely important, right? If you're looking at some of the ingredient that people are lobbying, especially when it comes to like breakfast food, like Kellogg's and like and all the cereals, the ingredient that we use here are banned like literally almost everywhere in the world. So why is it okay for us to, you know, ingest all those ingredients where in other country they say like, no, this is actually really bad to ingest, right? And the biggest chronic disease that I always talk about is obesity, right? Because once you're obese, you tend to have cardiovascular health, right? You tend to have like different chronic disease that you have, especially like joint, and you're gonna have increasing risk of Alzheimer, right? And the biggest thing is being um, insulin resistant, right? That's gonna create a whole cascading effect of how you're able to enjoy your life, especially in your later years. Um, the biggest thing is, in healthcare, we're really good at making people live longer. So that means, you can like compare to where we were like 100 years ago, like where life expectancy might be in the 60 or 70. Now we get to live to 80s and the 90s, right? But once we get towards the end of the 80s and 90s, we actually don't have better quality of life. Anything, we're actually worse. So it's almost like you're living longer, but you're not living a fulfillment life. You're probably going to be has at a high risk of being on disability because you can't move. You have like high chance of arthritis. You can't move as much. You can't travel the world. So like I tell my patient all the time, especially on the parents, is like, especially the people in the sandwich generation, which mean they're taking care of their elderly parents and they're taking care of their kids, and they see what they used to be by looking at their kids, and they see what they're going to end up like by looking at their parents. And most of them are really afraid because there's a huge steep decline when it comes to quality of life. Um, the biggest thing that really broke my heart was when my wife and I traveled to Venice for the first time. It was like our dream trip, and we saw these two elderly couples where, if you go to Venice, there's no there's no pave. It's all cobblestone. There's a lot of stairs, and the husband was on a wheelchair, and the wife was pushing the wheelchair around. And they weren't able to get anywhere, and they actually need to ask for help to get around. And that's, to me, that was like a daunting effect of like, okay, this is where we're going as a country, and this is where healthcare is really failing people. Because if you're working so hard to save up money so you can enjoy your retirement, but by the time you get to your retirement, you don't get to enjoy it because you're not capable of walking up and down the stairs and to enjoy those, do the sightseeing trip that you planned your whole life and you work so hard for it. And that's really not the best thing for us to do, right? So the approach is so different. Um, and I think it's all start out with the food that we get to eat and consume every single day. The nutritional reform is absolutely huge. I think there's also a crazy statistic out there. Like right now, like 80% of men would be deemed unfit to be able to serve in the military, right? So we came so far along this path where like we need to be able to turn it around immediately. And if we can turn this around now, the future would be a lot brighter for everybody. So like I love the fact that like the movement of making America healthy again, because that's extremely important, and incentivizing like big insurance company to actually reimburse for gym membership, to reimburse for like nutrition coaching, right? And that's going to put us in a way better path, right? So the first thing is them solving chronic disease, because that's extremely important, and that's going to help us increase the health span of our future, right? The next thing is actually reducing healthcare costs, right? Because right now, in 2023, we spent around like $4.1 trillion, right, for healthcare. And again, spending that much money, we still it is accounting for 90% of the population who have chronic disease. So we definitely don't want that. So be able to reduce healthcare costs and make it not a mandatory to have healthcare. And what that's going to mean is that it's actually going to help lower uh, healthy individual cost, premium costs, right? If I'm a healthy individual and I have low family risk, there's no reason why I have to pay so much for healthcare because I don't use it as much, right? Or if you are paying for your healthcare, and I see this every single day where we have patients coming in, they want to use their insurance benefits, they want to be able to use all their allow amount for physical therapy. And what happened in the past is that if, let's say, you or your child got injured and you want to come into PT, insurance company, their job is to deny PT immediately. And I'm saying this is a real world example where we had someone who her daughter tore her ACL, got surgery, and within 3 weeks of PT, they start denying PT already. And that's not fair because she has 90 visits that she should be entitled to use. But insurance company make money by making sure that they don't reimburse someone like me, the provider, the fair rate amount. And they also are stopping the patient in using their healthcare benefits. So that's kind of like me paying for my car insurance and I get in car accident and the insurance say, no, I'm not going to cover for it. So why am I paying for that? Right. And if you're healthy, your premium should be lower because you're not going to use it as much, right? The fact that we're beholden to pay a certain rate is kind of wild to me, right? Because that money that you save, you could put that into your grocery to eat healthier, right? Because you know that grocery bill goes up every single week, especially if you want to eat organic, like, grass fed and all of that stuff. Like we should be incentivizing that. And what's that going to do after you reform the healthcare costs? It's going to actually put money back in the pocket so you can reinvest that money towards your 401k or something that, or retirement or college education, right? This is something that's extremely important and it's all play all all together, right? And you know, I can't stress this enough when it comes to the 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 obesity rate in this country because if you send kids to school, public school, and they have lunch at school, right? Those lunches are literally not the best food that they get to eat, right? Is kind of low quality, low grade, and there's history of lobbying in the past where they want to just give us the worst quality food so that way they can cut costs, and then the government then incentivize those big food company to provide more but then lower the quality of care. So like there's no one holding them accountable of what kind of food we should be feeding our children, right? So when you see all of this, and why is this important, right? It's important because if I'm working with someone and they just have surgery, our job is to decrease inflammatory agent, especially in their body. And it's all start with food and stress management and sleep, right? If the food you're eating at lunch at school is not the best food and it's going to increase inflammatory marker because they have like, you know, high sugar content, like all processed food, like again, high, pesticide, herbicide, like that's going to actually increase your estrogen receptor. And then when your estrogen receptor go up, you're going to attract more estrogen. And when you attract more estrogen, you can increase cortisol. Now, this is not good for the healing process because we want lower cortisol, we want lower estrogen. And it's all play a role because if you look at the US as a country, we tend, especially like female population, we tend to hit puberty literally like 3 to 4 years earlier compared to all the other country. It's all because there's so much estrogen receptor inside our body, right? Everything is fast, everything is quick, and everything has high concentration of plastic, which also increase your estrogen level. So, and again, all this contribute to obesity rate, and I feel so bad for the people who are struggling with that because it's so hard to lose weight. And if you're consuming the food that they just giving you at school, right? You're just you're perpetuating the same, endless cycle, right? One podcast I was listening to, and they were saying that there's nothing more profitable than to have a sick child, because when you are sick and you're young, you tend to be on medication for a long period of time, right? And then pharmaceutical company, insurance company can capitalize on that because all they're going to do is they're going to give you more drugs, and on average right now Americans are on like 5 prescription drugs, and we're on 5 prescription drugs, and we're not getting healthier, and we're not getting better quality of life, and we live shorter lives. Like, so that means those interventions are currently not working, right? So it's really important to actually look at the root cause of why things are heading down this path rather than just accepting things as they are, because what they are currently not working, right? So those are some point I'm really excited about. Now, the one thing that I'm really hopeful for is addressing pharmaceutical company ability to advertise, because we're one of the 5 nations that actually allow these pharmaceutical companies to spend so much money on advertising their drugs, right? So if you're like up late at night and you're feeling sleepy, but you can't sleep, and you're feeling anxious because you don't know what's going on in life, and you see one of these commercial about antidepressant and your anti-anxiety medication, you're gonna fall and you're gonna subscribe for that, and you're gonna go and the whole point of marketing it is so that way you feel less than, and they try to make you feel like, well, other people doesn't have anxiety, so neither should you. Why don't you take these drugs? Where if you look at some research, like anxiety is really good for us to some extent, right? Where it's completely not hindering our ability to go and carry day to day, activity, right? So if someone just got surgery, especially after they tear the ACL or the UCL, they're gonna be anxious because they don't know what the future is gonna hold. But again, having a healthy amount of anxiety, that's actually gonna help you because it's caused us to take action, right? If I'm not anxious about my future health of like what I could be dealing with, then I'm not going to do anything about it today. So we tend to just completely do away with feeling sad and feeling anxious and make it not okay to feel those things. Where when you do feel those things, it's actually a good driver for you to move forward. One of one of the great movie I just watched, um, rewatched again actually was Inside Out, right? And then in that movie, the main character Joy is really trying to fight with sadness because sadness is kind of bring the mood down. And then towards the end, spoiler alert, is she realized that sadness actually has a huge role because when a child is sad, it creates an opportunity for parents to help the child overcome that issue or the obstacle they are dealing with. So in the case of season-ending injuries, when someone tear their ACL and they're going through rehab, it give opportunities for parents to connect with that child on a deeper level. And therefore, in that whole movie, it's all about sadness can help you create core memory because people are gathering around you and you feel like you have support, you have community, and you can start, you know, going through life, not feeling like you're doing it alone, but you're actually doing it with, a handful of people that dare to help you overcome those obstacles, right? One one thing too is they're talking about having reallocating like some like NIH funding, not only just researching how to solve disease, but actually how to increase, like how healthy we are as a nation, right? So it's better to create an environment where like, hey, if you do these things, right? Like someone like Andrew Huberman, who is a big name in the health and biohacking landscape is because he helped people optimizing where they are right now, right? So, like let's say you're underperforming and you're not sleeping well, rather than taking sleeping medication, he's like, well, why don't you go get up early, get some light exposure, right? Delay your caffeine intake up to 90 minutes, and then from there, you know, don't use your phone. Don't look at TV 90 minutes before you go to sleep. You're going to get better sleep pattern from that, right? Those are something that actually is important because it's going to help you create a really good routine where you can solve all the problem that you're dealing with and help you cure some of the diseases that you might not even have it in the first place because you have a better approach to having a healthier lifestyle, right? So I think having funding reallocating to that is going to be extremely important for where we go as a nation, right? So when someone come to work with us here, we always talk about like, hey, how stressful are you right now? And like, what's your sleep routine look like? Like, how much water are you drinking throughout the day? And nutritionally, like, what are you eating, right? I can't stress this enough. Where we have kids who come in, they tend to be under eat when it comes to protein, and you need protein to give you amino acids so that way you can break it down and then start the healing process, right? Because protein is extremely extremely important, right? But those are education that are really not part of our day to day, right? You don't go to, I went to public school and we have health class, but those health classes are not addressing like, hey, here's how you need to eat, here's what you should be eating, instead of like eating this instead of eating that, right? Understanding how calorie works, like calories in and out. Like those are extremely important and fundamental for us to understand as a society. So that way we can move towards being a healthier, country rather than a sick country, which where we are right now. Now, the last point that I can't stress enough is actually having transparency when it comes to health insurance. And we strive to do that with anyone that come to work with us. We have a billing team in house that actually understand the ins and out of insurance, how insurance company works. And most of the time what happens is that if you go into a traditional healthcare model, and especially in network, right? Let's say you need PT. You tend to go to PT, you go 3 to 4 times a week. And then what happened is that because if those traditional healthcare, especially PT, are in network, their reimbursement is capped by the insurance companies. So no matter how much time they spend with you, they're gonna get the same amount. On average in New Jersey, we're looking at like $50 to like $60. So if you're going in, you're gonna be spending time with your PT for like 10 to 15 minutes because they need to see 4 patient to 5 patient an hour in order to cover the overhead, right? So understanding that it's going to make a massive shift on how you're going to invest your dollar when it comes to your own care, right? We do one-on-one at Myokinetics. And because we want to spend as much time with our patient as much as possible, for 45 to 60 minutes, sometimes to 90 minutes, because that's what needed to get patients better faster. And that's why we're out network, because we can't have insurance company dictate what we can and cannot do when it comes to giving our patient the best care. You know, I used to work with in the traditional model in the past where, if my patient were able to go up and down the stairs 2 flight after a big surgery like an ACL, they would say, "Yep, this patient does not need PT anymore." And that's not fair, because the patient wants to actually get back to be able to play soccer, to be able to play football, and you know, having insurance company dictate what is an ideal lifestyle for you, that's not the way to live, because they don't know who you are as a person. And for them to say like, oh no, you're good enough because you can go up and down the stairs and walk 150 feet, you don't need PT anymore. Like who are they to say like that's how you should live your life, right? That's why being transparent is extremely important. Like, we go over the benefits, we tell them like what's going to cost, how it's going to be, how do we help taking care of, like the insurance error, and we fight for our patient every single day. Like last week, like what insurance company has started doing now, and it's absolutely irritating to me. And I think I have to speak on this, because some of you guys who are going through PT right now, you might not know this, but if your provider or myself happen to bill your insurance directly out of network, the insurance company will not work with me directly. But what they'll do is they'll send you a claim to a third party payer, and that third party payer will lowball and pay us at like $27. And then what we have to do is we have to fight the third party by getting the patient involved. Then the third party have to say, oh, you know what, we'll reconsider, we'll reprocess the claim. And then that take another 30 to 60 days, right? So now not only the healthcare provider is behind when it comes to getting payment, the patient is now accruing balance, because insurance company does not want to pay in the first place. But they have no problem taking the money out of your account every single month when you need to pay your premium. So that's extremely unfair, right? And I subscribe to the model that if I'm paying for something, I have the right to actually use it, right? So if I'm paying for my health insurance premium every month, I should be able to use that when I see fit, rather than them telling me when I can and cannot use it, right? So the model is broken. So them implementing, healthcare transparency, it's actually going to make you, the consumer, make better decision, informed decision on how you can manage your own care, and pick the provider that's actually best for you, rather than a provider that's in network and convenient. Because when you choose convenient over quality of care, you tend to get less. And you know, my my mom and my dad always tell me this, like, listen, you might save money in the short term, but you end up going to pay it for in the long term, right? So if you save money, by just paying, going in network, yeah, you're going to save money. But guess what? If you might not be 100%, and you might need another surgery, and you might miss out on a lot of things in life that have to offer, right? So now, if you're on a travel team and you're a junior, like, your child is going to miss out on the opportunity to get recruited to play, to play sport in college and earning that scholarship. So it's extremely important to make that decision long term, not what's convenient and what's safe, right? So all in all, just a quick, first thought of this. I'm really excited to see the landscape of healthcare, where it's going to go, because now you have someone that fully invested and understand how this whole system works, and going in to break the system, because the system needs some sort of disruption. The reason why my clinic exists is because we're a disruptor of the traditional healthcare model, especially when it comes to PT, because we want to put our patient first, give them the best care, and then ask insurance company to pay us appropriately for the things that we do, all the training that we do, to make sure that we get the best outcome, right? I'm I'm subscribed to the model where if I can do a better job than a traditional healthcare model, then we should be incentivized to do so, right? Because at the end of the day, that's how people should get rewarded. We should be get rewarded through merit, not because we play the game that they set up for us. And that game was set up for us to fail as a clinician and to fail as a parent and as a patient. So, that's just a quick thought that I have so far for this kind of crazy week after the election, and there's a lot of silver lining amongst the chaos. And I'm just putting this out there so that way you guys can start looking at your future, planning for it, and open enrollment starting this month. So when you are looking to enroll in a new healthcare plan, you should ask these questions. Hey, what's my deductibles going to be? What's do I have out network benefits? Like how many visits do I have for PT, Acu, OT, chiropractor, right? And this is the biggest thing. Do I get any an incentive if I join the gym? Will you reimburse me from joining the gym? Right? What if I don't use my insurance at all? Is there an opportunity for me to save money elsewhere? Right? Can I use my HSA account to pay for my gym membership? Right? Can I use that to pay for a better mattress so I can sleep better? Right? This is something that you need to be asking questions for, because at the end of the day, they're going to take money out of your account no matter what. And you need to know what you are paying for. And that's the biggest message I want to send today. Like, know what you're up against, know what the machine in the work of why the system is broken, and start demanding better, right? If you're working for a big company and a big firm, like talk to your HR representatives like, hey, listen, this insurance plan does not work for me. And it's not going to work for 90% of my colleagues. Like, can we pick a better plan? Right? Don't just accept the things that they're giving you. Start demanding, because if you're going to work your tail off for a company, the least they can do is make sure that you and your family are taken care of when it comes to your health. So that's it for a quick 25 minutes rant when it comes to this whole landscape, and I'm just really excited to see. And then I'm going to start doing more and more of this, just to kind of let you guys know my thought, what it's like to be in the healthcare, and how this impact my day to day and my patient every single day. And it's going to be daunting, but I think we have something to be excited about and to look forward to. And like always, we're here for you guys. You can always reach out to us. Go to myokinetics.com, myokinetix.com. You can book a call with us if you want to work with us. You're in New Jersey. If you're not in New Jersey, we're also going to be able to help too. And we can help. Guess what? We're going to point you in the right direction. So thank you so much for tuning in. I'll see you next time.